Hi, I'm Dr. Robert Hauser, professor of neurology and director of the Parkinson's Disease and Movement Disorder Center at the University of South Florida. In this presentation, I'll be providing a brief view of Vyalev. So Vyalev is a levodopa-based therapy that's delivered subcutaneously, typically over 24 hours. It's indicated for the treatment of motor fluctuations in adults with advanced Parkinson's disease. It consists of the prodrugs foslevodopa and foscarbidopa, which are converted to levodopa and carbidopa upon entering the subcutaneous space, and these are then absorbed into the bloodstream. Vyalev is designed to provide steady blood concentrations of levodopa through the day and night and provide consistent levodopa delivery to the brain. So, by way of background, in early Parkinson's disease, patients can be maintained on oral carbidopa levodopa immediate release, typically administered 3 times a day, and patients get good benefit lasting from dose to dose. And this occurs despite the fact that levodopa, when administered with carbidopa, only has a half-life of about 90 minutes, and I think of it as staying in the therapeutic zone for only about 2.5 hours. Nonetheless, it provides that benefit lasting many hours dose to dose in early Parkinson's disease, and we think that's because levodopa finds its way up to remaining dopamine neurons, is converted to dopamine, stored, and then released over many hours. But this ability for the medication to last for many hours diminishes as the disease progresses. As patients lose more and more dopamine neurons, that ability to take levodopa, convert it, and most importantly, store and slowly release it over time is diminished. So patients find the benefit from each dose only lasts a few hours, and then that benefit wears off, and they experience return of Parkinson's symptoms, including slowness, stiffness, tremor. And they may initially notice this when immediate release levodopa is only lasting 4 hours, and then it lasts 3 hours, 3.5 hours, and ultimately levodopa provided orally in the immediate release formulation only lasts about 2.5 hours. So we need better treatments to smooth patients' fluctuations through the day and maintain good control. So that brings us to levodopa, the subcutaneously administered levodopa therapy. And one would expect that Vyalev would be helpful to treat motor fluctuations by avoiding the gut, which is one area that causes variability in pill absorption, and by providing a steady stream of levodopa to the brain. In addition, one might expect it to reduce morning off, that is, when patients first wake up in the morning, as well as overnight off. Vyalev was evaluated in a 12-week randomized phase 3 pivotal trial comparing Vyalev to oral immediate release carbidopa levodopa. Patients with Parkinson's disease who were experiencing at least 2.5 hours on their levodopa regimens were enrolled into the trial. There was an initial stabilization period where their levodopa and CMT inhibitor regimens were all converted over to oral carbidopa levodopa immediate release. And once that was completed, patients were randomized into a 12-week double-blind treatment period, and they were randomized either to Vyalev infusion plus oral placebo capsules in lieu of their levodopa IR, or they were randomized to continue on their oral carbidopa levodopa immediate release and also to receive a placebo subcutaneous infusion. The primary outcome was mean change in good on time from baseline to week 12. Good on time refers to on time without troublesome dyskinesia. So, what happened with regard to the primary outcome? Well, what we saw was that patients who received Vyalev experienced an increase in good on time of 2.72 hours per day, whereas patients who continued on oral immediate release carbidopa levodopa experienced an increase of good on time of only 0.97 hours. And thus, there was a greater benefit with Vyalev of 1.75 hours per day, increased good on time, p-value equals 0.0083. And there was a similar result regarding off time. Off time was more reduced in the Vyalev group compared to immediate release carbidopa levodopa. The most common side effects were infusion site reactions and infusion site infections. However, the majority of these were mild to moderate and resolved with or without treatment. There were two other outcomes that I'd like to mention. One is morning off. Again, when patients wake up in the morning, what we saw was that Vyalev, of the Vyalev patients, only 17% were waking up with morning off, whereas patients who continued on oral carbidopa, levodopa, immediate release, 63% of those patients were still experiencing morning off. Another outcome that we looked at related to overnight sleep, and we evaluated sleep using the Parkinson's disease sleep scale version 2. And what we saw there was that patients on Vyalev experienced a 36% improvement in the scale, whereas patients on oral carbidopa levodopa only improved 13%. Now, I must say that with regard to morning off and the Parkinson's disease sleep scale, although we saw these changes, they're not considered statistically significant because they fell lower in the hierarchical list of outcomes than one of the outcomes that was not statistically significant. So, in summary, then, Vyalev is a levodopa-based therapy that's infused subcutaneously. It replaces all oral levodopa and CMT inhibitors. I showed you that in the pivotal study, it provided statistically significantly more on time without troublesome dyskinesia than oral carbidopa levodopa immediate release. It's provided as a subcutaneous infusion, typically 24 hours a day.